Hi everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And we're here with Kristy Dickinson. She's the founder of Chronically Simple. Welcome, Kristy.
Thank you for having me, John.
Yeah, so tell us, what is Chronically Simple?
Chronically Simple is a web-based and mobile app that I've created to help people living with a complex or chronic illness or a disability manage the administrative burden that accompanies that journey.
Interesting. So how does it help someone who has a chronic condition?
So it is, I'm sure you're aware, people that live with a chronic condition or a complex illness carry binders. And we have to be on top of and organize all of our healthcare providers, our medications, our symptoms, our expenses. And so really, Chronically Simple is just a digital binder. It's like an administrative tool to help keep everything together and organized, remind patients to attend their appointments, make the most efficient use of the time with their healthcare providers, take their medications, just kind of everything.
Interesting. Now, my favorite was when the patient with a chronic condition can't even carry the binder because their condition doesn't even allow them to do it.
Yeah, it's too heavy. My caregiver colleague, her son had 230 specialist appointments in his first year of life.
Wow.
She stopped collecting his information when he was 5, and she had 7 full binders, and he was in a wheelchair. So imagine lugging that to a specialist appointment.
Yeah, no, it's amazing to think about how challenging that is, let alone the medication reminders, the appointment reminders, which it sounds like that's a core functionality as well.
Yep, absolutely it is, yeah.
So how did you decide to build this? I mean, I think it's pretty amazing that you've built an app like this.
Well, it came out of need, really. I am a person that lives with Ehlers-Danlos syndrome, which is a rare connective tissue disorder, and I've got a few other comorbidities that accompany that. So my healthcare is complex and divided across 3 hospital jurisdictions and 11 different specialists. So it was a lot to manage, and I struggled at times to keep everything together, especially when we were trying treatments and I had some brain fog. My cognitive ability was not as sharp as normal.
Definitely.
So I needed something to help me stay organized. And when I went out to my community and said, all right, how do you guys do this? The response was binders. And I started my binder, but that's not secure. You forget a binder, you spill coffee on your binder, the wind picks up your papers. All of those are real live use cases that have either happened to me or our users have shared. And I thought there's gotta be a better way. So I went looking for one, and I couldn't find one that did everything. So it's overwhelming to try and manage a chronic illness or be in a caregiving role. And the last thing I wanted was 5 or 6 different apps to have to manage on top of it. I wanted everything in one place. So when I couldn't find it, I decided to build it.
That's brave of you to do. I mean, I think many watching are like, well, isn't the portal there? Which, I understand is an ironic one because there's actually, we call it hyperportalosis. It's a diagnosis of so many portals.
So many portals, yes. Gosh, there's so many portals.
Yeah. What's it like though when you bring on, the Chronically Simple app and you provide the full record to the doctor? What's that experience like? Does it just seamlessly go to the EHR? Or what's the approach?
Yeah. So that is our goal. And what I'm actively working towards is that connectivity or integration with EHRs and EMRs. Right now, the burden is still on the patient to provide that information. You can send it through email directly within the app, or pull it up and show your healthcare provider if you're in person.
Gotcha. Well, and then will they even allow the email? I mean, I think those are the challenges. Yeah. So it would be nice to get that in EHR integration.
Absolutely.
Well, where can people go to learn more?
They can go to our website at chronicallysimple.com. We're in the App Store and Google Play. And like I said, we've got a web app, and you can sign up from there too. Awesome.
Thanks so much for sharing about this application. It's really interesting to see you working on it because it is such a problem especially for those with chronic conditions. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcasting application. Thanks, Kristy.